Well, many of you may be noticing lots of coughing and sneezing out there. Spring pollen is in bloom, leading to allergic symptoms, and there are also plenty of infectious diseases circulating. How to tell the difference can be puzzling. We have our own medical expert, Dr. David Winter from Baylor Scott White Health, here to help us distinguish infections from allergies. Good morning, Dr. Winter. Always happy to have you. Want to get to our top question here. How do you diagnose the cause of a cough or a sneeze when a patient calls with those symptoms?
Well, Tashara, it can be tricky even for seasoned physicians, but here's some tips. Allergies, for example, typically they have a lot of sneezing. Sneezing is less common with infections. Infections typically have a fever, not likely to happen with allergies. If you have allergies and you have drainage, it's usually clear. If you have an infection, it usually is thick and discolored. And you have a cough with an infection, it's pretty voluminous and a lot of brown, green, yellow stuff in there. Cough with allergies is typically mild. Also with allergies, itching, itchy nose, itchy mouth, itchy throat, that's allergies. And then severe fatigue, severe muscle aches, that's infections. Now both of those can be mild and can be treated at home, but you might want to know the difference if an infection is around there because you may need antibiotics for that. And then you got COVID out there, which I'll call the great imitator. COVID can have any or all of those symptoms, Tashara.
When should someone mention, because you mentioned antibiotics, so when should someone seek medical attention and when can you just stay home and treat yourself with over-the-counter meds?
Yeah, if you have mild symptoms and no severe muscle aches, no severe fatigue, no high fevers, you can probably stay home if you're otherwise healthy. Now, if you have an immune system that's compromised or if you're around people that wouldn't do well if they got infected, you might want to get a diagnosis and stay away from those folks if you have an infection. You know, we've actually got the COVID tests now that are still over the counter and available and they're free. And that's an easy way to see if you have COVID or not. So a lot of considerations whether you ought to see a doctor or not or seek medical attention.
Absolutely. Are there indeed more sick people out there, Dr. Winter, and does the weather have anything at all to do with this?
Well, it sure does with allergies. We're seeing now a lot more pollen out there. You know, winters have been milder the last couple of years, and the average temperature in the world actually has gone up. That allows these plants to pollinate. In fact, we've been told that we're seeing 20% more pollen and 20% more days of pollen than we have in the past. So yeah, lots of allergies out there. A lot of infections this year also. As people congregate together, many infections are spread through the air, so a lot of that's going around. So yeah, there's more infections and there's more allergies going on right now.
Speaking of infections, strep infections, we've heard a lot about that lately. We talked about this a month ago. Is strep still out there?
Yeah, and it's come back again, particularly in kids. Now, adults get it also, and strep's usually pretty easy to diagnose. The back of the thread is red, beefy. They have little white pus pockets on or around the tonsils. Maybe a little bit of fever, not much of a cough, not much congestion. That's strep. And you can do a strep test with a swab. That's pretty easy to get done also. Right now, there's a shortage of treatment for kids with the liquid amoxicillin. That's the preferred drug. So you may need to crush up the pills for your kids, or you can also use penicillin shots. Cephalexin works. A lot of things work for this, but I want to emphasize the fact that there's a lot going on right now with the allergies. They're not contagious, but the infections are. So if you see somebody coughing or sneezing, you might want to cover up your mouth, hold your breath, walk the other direction. You don't want those bugs to get in you or on you.
Dr. Winter, I can't tell you how many times I've held my breath trying to get past someone coughing. I am that person. Always great information. Thank you so much for joining us this morning.